Distinguished guests, ladies and gentlemen, your excellencies, welcome to this official virtual side event happening on the margins of the 2025 high-level political forum titled Celebrating 20 Years of the WHO FCTC, Tobacco Control for Sustainable Development. My name is Ryan Sabitz-Parry. I work with the Secretariat of the WHO FCTC, and it's a pleasure to moderate today's event. Before we begin, please note that today's session is being recorded and interpretation is available in 6 UN languages. That's English, French, Spanish, Arabic, Chinese, and Russian. Yesterday, the HLPF on Sustainable Development opened in New York under the UN Economic and Social Council. This year's theme is advancing sustainable, inclusive, science and evidence-based solutions for the 2030 Agenda and its Sustainable Development Goals. As you know, the forum will review a number of SDGs specifically, including SDG 3 on health, SDG 5 on gender equality, SDG 8 on economic growth, SDG 14 on life below water, and SDG 17 on partnerships. And while we know that tobacco negatively impacts all SDGs, it is important to reaffirm how it impacts those specifically in review this year. With regards to SDG 3 on health, we know that the tobacco industry harms health and interferes with policies directly at the government and intergovernmental level. SDG 5 on gender equality, we know that women suffer disproportionately from the dangers of secondhand smoke and tobacco-related health issues. SDG 14, in terms of life below water, we know that discarded cigarette butts and plastic filters contribute majorly to ocean pollution. And SDG 17 on partnerships, we know that illicit tobacco trade undermines public health, fuels crime, and reduces tax revenues. And of course, underlying all of this is the key message that tobacco remains a major obstacle to sustainable development across multiple sectors. Today's event, therefore, offers us a great opportunity to reflect on 2 decades of impact and progress of the WHO FCTC and public health as a whole. As we know, this year marks the 20th anniversary of the entry into force of the WHO FCTC. And for this, we have a distinguished lineup of speakers from ministers to UN officials and academics. We will hear from them how the WHO FCTC has been instrumental in galvanizing 2 decades of progress on tobacco control, and we'll of course explore main challenges and paths forward for tobacco control within the 2030 agenda. Before we begin, let's start with a short video highlighting the impact that the WHO FCTC has had on the world over the last 20 years. Thank you very much for that. Without further ado, it's a pleasure to welcome our first speaker to make some opening remarks, Dr. Adriana Blanco Marquizo, the head of the Secretariat of the WHO FCTC. Madam, the floor is yours.
Thank you, Ryan. Excellencies, distinguished delegates, colleagues and friends, good morning, afternoon, and evening. It is my great honor to welcome you all to this side event at the 2025 High-Level Political Forum, celebrating 20 years of the WHO FCTC, Tobacco Control for Sustainable Development. 20 years ago, the WHO Framework Convention on Tobacco Control came into force, representing not only the first treaty ever negotiated under the auspices of the World Health Organization, but also a groundbreaking commitment by the global community to protect from one of the most devastating public health threats of our time. Over these 2 decades, the WHO FCTC has evolved beyond its original scope. Today, it stands as a powerful catalyst for sustainable development. Embedded firmly in the 2030 Agenda, the WHO FCTC contributes directly to Sustainable Development Goal 3, ensuring healthy lives and promoting well-being for all at all ages. Target 3 explicitly calls for a strengthened Target 3A, explicitly calls for a strengthened implementation of the WHO FCTC, recognizing that reducing tobacco use is fundamental to lowering the burden of non-communicable diseases, protecting vulnerable populations, and enabling social and economic progress. But tobacco control is not only a health imperative, it is also a developmental one. The WHO FCTC's comprehensive measures address a wide range of social, economic, and environmental determinants of health. By reducing healthcare costs, improving productivity, preventing environmental degradation, and combating inequality, tobacco control is truly an investment in a sustainable, equitable future. Today, with 183 parties representing 90% of the world population, the WHO FCTC stands as a testament to what multilateral cooperation can achieve. It has galvanized partnerships among governments, UN agencies, civil society, and communities, proving that collective action can drive transformational change. As we commemorate 20 years of the WHO FCTC, this event offers us an invaluable opportunity to reflect on the progress we have made, to acknowledge the challenges that remain, and most importantly, to reaffirm our shared commitment to ending the tobacco epidemic. I would like to take this opportunity to warmly welcome and thank all the distinguished speakers for the participation and leadership. Their country's experience provide invaluable lessons on advancing tobacco control and public health through legislation, fiscal policy, and regional collaboration. Let us remember, every life protected from tobacco is a step towards healthier populations, stronger economies, and a more sustainable and equitable world for all. Thank you, and I wish you all a productive and inspiring discussion.
Thank you very much, Dr. Blanco Marquizo, and of course for your continued leadership of the Secretariat as well. Next, let's come to some video remarks provided to us by His Excellency Mr. Zulkifli Ahmad, the Minister of Health of Malaysia. In his video remarks, we will hear about Malaysia's experience since the ratification of the WHO FCTC and the progress made thus far in the country. Let's listen to those remarks.
Your Excellencies, distinguished delegates, esteemed colleagues, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good day. It is both a deep honor and a solemn responsibility for me to address this gathering at such a meaningful moment as we commemorate 20 years of the WHO Framework Convention on Tobacco Control, WHO FCTC, the world's first international treaty negotiated under the World Health Organization. It was a landmark in global health, with a united stand against a man-made epidemic that has robbed millions of their lives, health, and potential. It is with that same conviction and clarity that we are gathered here today at the high-level political forum to reaffirm our shared commitment to tobacco control and public health as a pillar of sustainable development. Malaysia was among the early adopters of the FCTC. We ratified the treaty on 16 September 2005, recognizing early on the importance of a united approach to combating the global tobacco epidemic. Our journey since then has been marked by determination, learning and progress. In the 2 decades that followed this ratification, Malaysia has implemented comprehensive tobacco control measures, many of which are directly aligned with FCTC's provisions. These include a comprehensive ban on tobacco advertising, promotion and sponsorship, graphic health warnings, mandatory since 2009, which initially covered 50% of cigarette packs and were recently expanded to 65% to enhance their impact. Nationwide smoke-free zones, including restaurants, government buildings, hospitals, workplaces, and places of worship, and the expansion of cessation services under our national health system and partnership with NGOs and corporate, especially targeting underserved populations. Beyond policy, we have nurtured a growing culture of health where civil society, youth groups, religious scholars, and healthcare professionals stand together in rejecting tobacco's grip on our communities. Yet the journey is far from over. The tobacco industry continues to evolve, reinventing itself through aggressive marketing of new and emerging nicotine products, often targeted at youth. Their tactics may have changed, but their intention remains the same: to profit from addiction no matter the cost. Today, I proudly reaffirm Malaysia's unwavering commitment to the full implementation of the WHO FCTC. We are currently strengthening the enforcement of the Control of Smoking Products for Public Health Act 2024, Act 852, to ensure stricter regulation of both conventional tobacco and emerging nicotine products, including e-cigarettes or vapes. The implementation of Act 852 is focusing on control over smoking practices, which relate to the prohibition of smoking in areas or places where smoking is prohibited, and the prohibition of smoking for minors. Control over smoking products includes products registration, prohibition on advertising, promotion and sponsorship, sales control, price control, packaging and labeling. Our efforts are also rooted in the belief that health is not the responsibility of one ministry alone. We are fostering a whole of government, a whole of society approach, working across education, finance, youth development and civil society to ensure our strategies are integrated, sustainable and impactful. Excellencies and esteemed colleagues, tobacco control is not just about lungs and lives. It is also about fairness. It is also about intergenerational justice. It is about development. Tobacco-related illness disproportionately affects the poor. It deepens inequalities. It burdens our healthcare system and weakens workforce productivity. The WHO FCTC is more than a treaty. It is a tool for justice and a bridge to a more equitable world. As we reflect on the 2 decades of progress under the FCTC, we also stand at a crossroads. Will we allow this momentum to stall, or will we carry it forward with renewed urgency and unity? In Malay, we say, kalau bukan kita, siapa lagi? Kalau bukan sekarang, bila lagi? If it is not us, who will it be? If it is not now, when will it be? Let us honor the past, confront the present, and invest in the future. Let us protect the next generation from an industry that has taken too much for far too long. And let us work together towards a world where the air is clean, the lungs are strong, and every child grows up free from the shadow of tobacco and smoking products. I thank you again and terima kasih. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much to His Excellency for providing those remarks and for those inspiring comments on the effectiveness of the WHO FCTC in Malaysia. Let's next hear from His Excellency Mr. Rami Youssef, the Deputy Minister of Finance for Tax Policy and Development in Egypt, who will speak on his country's experience with tobacco product taxation. Deputy Minister, the floor is yours. I believe we may be having some IT issues in this regard. If it's okay, then what we will do, we'll move on to our Next speaker, the distinguished delegate from Burkina Faso, who will speak on the recent achievements of that country and the measures taken in Burkina Faso in implementing some of the measures of the WHO FCTC. Distinguished delegate, the floor is yours and welcome.
Alors, Madame le ministre de la Santé de la Malaisie, Mesdames l'ambassadeur représentant permanent du Burkina Faso auprès de l'ONU, de l'OMC, des organisations internationales à Genève, Madame la chef du secrétariat de la Convention cadre de l'OMS pour la lutte anti-tabac, Madame la présidente de la conférence des partis, honorables délégués, chers partenaires, au nom de son Excellence, le capitaine Ibrahim Traoré, président du Faso, chef de l'État et du gouvernement du Burkina Faso, je voudrais exprimer ma profonde gratitude au secrétariat de la Convention cadre de l'OMS pour la lutte anti-tabac pour cette invitation. Je tiens à rappeler que je lis ce message au nom de Monsieur le ministre de la Santé qui vient d'être empêché pour participer donc à cette réunion parce qu'il a une réunion au niveau de la présidence du Faso. C'est un honneur pour le Burkina Faso de se joindre à vous aujourd'hui pour célébrer en marge du Forum politique de haut niveau des Nations Unies sur le développement durable 2025, le 20e anniversaire de la Secretariat, ce traité historique qui a transformé la santé publique mondiale. Nous nous réjouissons de cette occasion de réaffirmer notre engagement indéfectible en faveur de la lutte anti-tabac, de la santé publique et du développement durable. Le thème de cet événement, la lutte anti-tabac au service du développement durable, est un thème qui nous engage tous et nous interpelle. Lutter contre le tabac n'est pas seulement un enjeu de santé publique, c'est un investissement crucial dans le développement, l'équité et la résilience de nos nations. Nous sommes convaincus que la mise en œuvre de la Secretariat est un levier puissant pour atteindre les objectifs du développement durable, notamment la cible 3.4.A. En tant que partie à la Convention cadre, le Burkina Faso a récemment traduit cet engagement en une série d'actions concrètes et audacieuses. Les derniers mois ont marqué une accélération sans précédent de nos efforts, avec l'adoption de 4 textes et mesures stratégiques qui modernisent et renforcent notre arsenal de lutte contre le tabac. Premièrement, pour nous attaquer au commerce illicite, le gouvernement a décidé, le 26 décembre 2024, de renforcer notre système national de suivi et de traçabilité des produits du tabac. Conscient des limites du dispositif précédent, nous avons choisi un nouvel opérateur afin de rendre notre système plus performant et garantir un meilleur contrôle du marché. Cette décision est conforme à l'article 8, section 12 du protocole qui recommande aux parties d'avoir leur propre système d'authentification, de suivi, de traçabilité et de vérification des produits du tabac. Deuxièmement, nous avons fait un pas de géant dans la réduction de l'attractivité des produits du tabac. En effet, le 12 mars 2025, nous avons adopté un nouveau décret sur le conditionnement et l'étiquetage des produits du tabac. Ce texte instaure le conditionnement neutre et standardisé, privant ainsi l'industrie du tabac de son principal support publicitaire, le paquet. De plus, il impose des avertissements sanitaires graphiques percutants associant texte et images qui couvrent désormais 80% des faces principales des emballages. Notre objectif est clair, de normaliser la consommation du tabac. Troisièmement, nous avons élargi la protection de nos populations en adoptant le 16 avril 2025 un décret portant interdiction de fumer dans les lieux publics clos ou ouverts et les transports en commun. Ce nouveau décret étend de manière significative la protection de nos populations. Fait crucial, cette interdiction s'applique explicitement aux nouveaux produits comme le chicha et la cigarette électronique et instaure non seulement des sanctions pour les contrevenants, mais aussi et surtout contre les propriétaires des lieux publics et des transports en commun. Enfin, pour piloter l'ensemble de cette stratégie, nous avons restructuré notre gouvernance par un décret portant création du nouveau Comité national de lutte contre le tabac en date du 28 mai 2025. Ce comité que j'ai l'honneur de présider est le pilier de notre action. Son caractère multisectoriel est sa plus grande force, rassemblant des ministères clés, la société civile, l'OMS et les leaders d'opinion pour garantir une approche intégrée. Excellences, Mesdames et Messieurs, ces réformes majeures de la lutte anti-tabac au Burkina Faso, menées en moins de 6 mois, ne sont pas une simple coïncidence. Elles sont la preuve la plus tangible d'une volonté politique renouvelée et démontrent notre détermination à protéger la santé de notre peuple, en particulier nos jeunes, contre donc les stratégies de l'industrie du tabac. Notre vision est claire, une génération sans tabac à l'origine 2030. Nous avons un environnement sain, libre des méfaits du tabac et où nos ressources publiques sont dédiées au bien-être plutôt qu'au traitement des maladies évitables. À nos partenaires, nous disons merci pour votre accompagnement constant. À nos pairs unis, pour la CECLAT, nous réaffirmons notre solidarité et notre détermination à traduire les engagements communs en actions tangibles au Burkina Faso. Ensemble, continuons de faire du traité un moteur puissant pour la santé publique, l'équité et le développement durable. Le Burkina Faso réaffirme solennellement son engagement à poursuivre et à intensifier ses efforts. Nous sommes fiers de partager ces avancées avec vous et nous continuerons de travailler en étroite collaboration avec le Secretariat de la Convention qui nous accompagne dans ce processus à travers le projet FCTC 2030 ciblant l'atteinte des ODD, l'OMS et tous nos partenaires pour bâtir un avenir sans tabac au Burkina Faso. Je vous remercie. Fin de citation.
Thank you, sir, for those remarks and for sharing the examples of those measures that have been implemented in Burkina Faso and are undoubtedly saving lives as a result in the country as well. Let's now come to Dr. Tamu Davidson. She's the Director of the Non-Communicable Diseases and Injury Prevention at the Ministry of Health and Wellness in Jamaica. Dr. Davidson will speak to us about the ongoing parliamentary processes on the bill and also the regional leadership in the Caribbean as well. Over to you, Dr. Davidson.
Good morning, all protocols, or good afternoon, all protocols observed. I'd like to thank the FCTC Secretariat for this invitation to Jamaica to participate in this important event. Unfortunately, our Minister of Health, Dr. the Honorable Christopher Tufton, was unable to make it for the event. So I am here representing the Minister today. Certainly, this is an important event, having passed 20 years of this FCTC, of which Jamaica participated in its crafting as well. So it has been 2 decades since Jamaica ratified the WHO FCTC treaty. And of course, a lot of progress has since been made in the Caribbean in advancing the demand reduction provisions of that treaty, including the implementation of smoke-free legislation, graphic health warnings, and taxation policies. So at today's event, we acknowledge the progress made, even as we recognize the very real need to persist in our efforts, given the essential requirements to reduce tobacco use, and of course, accelerate our efforts towards meeting SDG 3. The tobacco epidemic, as WHO tells us, it kills nearly 6 million people each year, and more than 5 million are the result of direct tobacco use, and more than 600,000 the result of non-smokers being exposed to secondhand smoke. Of course, these statistics are not something that we can turn a blind eye to, and certainly not when we consider our youth, who we know are especially vulnerable and the future of our own countries as leaders. So our data shows us in Jamaica that about 15.6% of students used tobacco products, 14.4% smoked tobacco, while 11.2% smoked cigarettes, and 2.6% use smokeless tobacco. Also in Jamaica, many of our people are dying younger as we face the clear and present danger of what we coin as an NCD's pandemic. NCDs, we know, are caused by 5 major behavioral risk factors that we have targeted globally, but certainly tobacco, which use is one of the most preventable. This is the reason why in Jamaica we continue to progress our years of work on the tobacco control bill, recognizing the need to develop and to sustain an enabling environment for successful prevention. And so it was in 2020 that we tabled the Tobacco Control Bill 2020. So Jamaica is committed to the success of this legislative process and to bring the bill into law. And our commitment is sanctioned by the data before us, which is overwhelming. In an investment case that was done and supported by PAHO and UNDP, we saw where in Jamaica an estimated 597 lives would be saved and over 7,355 healthy life years restored to the Jamaican population by implementing interventions to prevent tobacco use over a 15-year period. During this 15-year period, the return on investment for tobacco interventions show that for every dollar invested in tobacco control in Jamaica, one can see a 5.37 Jamaican dollars return. If we looked further, the total economic benefits were about 6.63 billion Jamaican dollars, significantly outweighing the cost of 1.9 billion Jamaican dollars of implementing tobacco control efforts. Further, it's estimated that over 1,000 people die each year from smoking in Jamaica alone, and that cost was estimated to be over 14 million Jamaican dollars per year. Some 5.2% of deaths were attributable to tobacco use in 2021, while the findings from the recent National Drug Prevalence Survey in 2023 reported that the prevalence of tobacco use remains high amongst our youth, and of concern is the prevalence of e-cigarettes use and vaping, especially along with cannabis use. This is why the Jamaica Tobacco Control Bill 2020 therefore will not really resile from its efforts as we proceed to ensure that we create this enabling environment to protect our population. It is now before the Joint Select Committee of Parliament, where the final report on its deliberations and recommendations are being deliberated before its presentation to the Parliament. The passage of the bill will allow Jamaica to be fully compliant with its treaty obligation under the WHO FCTC. The proposed legislation will protect Jamaicans, including children and the vulnerable, from the harmful and additive effects of tobacco use. Meanwhile, the island has and continues to pursue a range of other initiatives as part of efforts to preserve the enabling environment for the prevention of tobacco use. These include our current national regulations that has created a 100% smoke-free environment in both enclosed public and workspaces and public transportation. There are the graphic health warnings on tobacco packaging that met the criteria of the WHO report on the global tobacco epidemic, and the policy of standardized packaging has been adopted and was one of the strongest graphic health warnings, not just in the Caribbean, but around the world at the time it was enforced. So these rotating graphic health warnings require 60% of the two principal display areas on both unit and outside packaging. And so these graphic health warnings continue to be implemented and enforced. Our last tax increase was in 2017. And as Jamaica consistently prior to that had raised our specific consumption tax on tobacco products. These taxes go towards supporting our National Health Fund, which supports our chronic illnesses. Despite not meeting this target under the WHO FCTC with respect to tobacco taxes, there has been a progressive decline in Jamaica's imputed total cigarette consumption between 2006 and 2016 and the prevalence of current tobacco use in adults. Additionally, an estimated 23% of the excise tax on tobacco products, as mentioned earlier, goes to our National Health Fund, which is a significant contribution towards supporting persons who are living with NCDs. Meanwhile, there can be no question of the benefits of bold, strategic, and sustained leadership at both the national and regional levels in the Caribbean, as we look to finalize and implement the needed legislative process to make the Caribbean smoke-free. The fact is the Caribbean, as elsewhere in the world, continues to face significant challenges, including aggressive marketing by the tobacco industry. As leaders and collaborators, we possess the vision to prioritize tobacco control within our broader public health agenda, the courage to confront industry interference, and the capacity to mobilize cross-sectional action, even as we collaborate across borders. I pause here to recognize the collaboration of the Pan American Health Organization, the Healthy Caribbean Coalition, and the Framework Convention on Tobacco Control Secretariat, and WHO for the collaboration and support that has been in evidence across the region over these 2 decades. Our own research has shown how this has helped to catalyze and to move our countries forward to creating the smoke-free Caribbean we envision. I also want to acknowledge our neighbors and the region. There are several countries that have advanced their comprehensive tobacco control legislation within the Caribbean: Guyana, Antigua and Barbuda, St. Lucia, Trinidad, Barbados, Suriname, among some of the many countries that continue to do so. And their overall progress on tobacco control leadership has remained crucial in fostering collaboration, securing political will, and sustaining public engagement. In a region of small island developing states with limited resources, effective tobacco control demands coordinated action and shared best practices. Regional leaders play a vital role in unifying efforts, aligning policies, and ensuring accountability across governments and civil society. Furthermore, strong leadership can amplify the voices of those affected by tobacco-related diseases and champion policies that protect vulnerable populations. I must mention our Caribbean Law Forum, which was developed and created and continues to impact and support our efforts towards having these strong, comprehensive tobacco control laws in keeping with the FCTC agreement. In this context, leadership is not only about policy direction, but is also an essential catalyst for change, resiliency, and long-term public health impact. We look forward to another 20 years of working towards having the world and the Caribbean and Jamaica tobacco-free, and we continue to look forward to us ending this epidemic. Thank you, and we look forward to hearing more about the proceedings.
Thank you very much, Madam, for those remarks, and of course, we look forward also to our continued collaboration with Jamaica on these measures, of course, as well. One last time, I'm going to just check the room for His Excellency, the Deputy Minister from Egypt, just to check if we can come to those remarks. If not, we will move on as well to our next speaker as well. So just to open it up there. If not, we will then come to our next speaker as well. Just as Dr. Davidson mentioned as well as she was speaking, she mentioned, of course, the aggressive marketing by the tobacco industry and, of course, industry interference as being one of those major challenges. And of course, at the WHO FCTC, we have time and again acknowledged that one of the greatest ongoing challenges to the implementation of the measures of the WHO FCTC is the tobacco industry itself, who today often positions itself as part of the solution to the problem it itself, of course, created. On this topic, we have an excellent speaker who will speak on these very issues, Dr. Stella Bialous, a professor at the Department of Social and Behavioral Sciences at the University of California, South Africa. Dr. Bialous, it's great to have you with us, and the floor is yours.
Thank you. I hope you can hear me well. Just the corrections, University of California, San Francisco, not South Africa. We don't have a campus there, at least as yet. If I could have the slides, I think I prepared some slides. Thank you very much. Distinguished, Your Excellencies, distinguished guests, distinguished colleagues, thank you so much for the invitation to participate in this important event celebrating the 20 years of the convention and how it is and remains so closely linked to the SDGs. Next, please. The convention, it was really smart when it was being developed by the people who developed it, because it already predicted that the tobacco industry would be a problem in reaching the goals of the convention. And we know study after study after study, as well as testimony from the parties and various governments, how the industry has been one of the greatest barriers to achieving the goals of the convention. So it actually included an answer in the text of the convention as part of Article 5, Paragraph 3 of the convention that actually sets right there that in setting and implementing their public health policies with respect to tobacco control, parties shall act to protect these policies from commercial and other vested interests of the tobacco industry in accordance to national law. It is important that this article, just like the convention itself, is to be implemented across sectors. So it's not just for the Ministry of Health, for example, it's for all government departments. Sometimes you need to implement it one step at a time. Sometimes, and it's always better if it can be formalized and incorporated into your national tobacco control or public health plans and practices. And it's good to find out that sometimes we may already have opportunities to implement in your existing, in your existing country, that there might be opportunities, and I'll talk to a little bit about that. Next, please. And the parties of the convention went further and developed guidelines for how to implement this article, because, you know, prevent industry interference is a very broad sort of statement. And so if you look at the guidelines, it provides several very specific guidance, and I'm going to speak about a couple of them in a few minutes. But it is based on the main principle is that there's a fundamental and irreconcilable conflict of interest between the tobacco industry interest and public health policy interests. And that's why when you hear talking about the convention and the SDGs, it's clear that we need to understand that there can be no partnership between the industry and governments into reaching the sustainable development goals because they have a fundamental and irreconcilable conflict of interest. The guidelines also calls for more accountability and transparency, for rules of engagement, because governments still will engage with the regulated industry like the tobacco industry, and also how to avoid conflict of interest at all levels. Next, please. But what is exactly tobacco industry interference? How can we define this? And these are the words of a former executive from a large tobacco company. And this is what it says. It's a quote from a document that was an internal document that is now public after lawsuits in the United States. Our goal is to help shape regulatory environments that enable our business to achieve their objectives in all locations where we do business. Our overall approach to the issues is to fight aggressively with all available resources against any attempt from any quarter to diminish our ability to manufacture our products efficiently and market them effectively. In short, we are very clear about our objective, an unyielding and aggressive defense of our rights to make and sell our products and our consumers' rights to have free marketplace so they can choose and use these products. So that is exactly what the industry does. Again, this is an example from one person from one company. You think, oh, but this is old. No, this is still very much the case where particularly if Parliament is discussing legislation, the industry will be using lobbying, will be presenting different language, will try to create loopholes. Next, please. And this is because some of their main goals are, of course, profits. And if you decrease consumption, you may decrease profits. And above all, for excellencies here who are engaged in legislation and policies, either at the parliamentary or the executive levels, the industry tries to block, weaken, or delay legislation and policies in all stages of the development. So it's not just because a law has passed, for example, that means the problem has been solved. You need to maintain attention because that could be efforts to interfere with the implementation language or with the regulatory language for legislation, for example, that requires further steps. The industry tried to create controversy. They don't need to prove that they are right or that they have better data, which they usually don't. What they need to do is question the data that others are providing. And they want to be part of the decision-making table. And it's very important that this is where we need to understand that, particularly when thinking about sustainable development goals, the decision-making, there's no place for the tobacco industry there. And the tobacco industry, despite other claims, they have not really changed. Next, please. And how do we know they're not changed? They still get the majority of their revenues from the sales of cigarettes. That's where the most of the money comes from for them. They're still opposing policies that have been in place for decades in some countries, such as 100% smoke-free environments and pictorial warnings. If they really wanted people to stop smoking, why are they opposing evidence-based policies? And they use the same arguments for decades. Next, please. So how do you know if your country or your policy or your legislation is at risk for tobacco industry interference? Well, you should always assume that you are at risk. So at any time that there is a development or approval process of legislation, policies, programs, projects, or any funding that are related to tobacco control in its various areas, in multi-sectorial areas, there is a risk. And that includes taxes, discussion on warning labels, discussing on smoke-free environment, discussions of product regulation, for example, banning the sales of flavored tobacco products, discussions on illicit trade. So it's important that you always be aware of what the agencies involved in this decision-making and give them a heads up to be able to resist against tobacco industry interference, to be alert that the industry may be trying to come in with language, for example, for regulatory, that is actually favoring the industry and not public health. And it's always important to observe all the process requirements. Next, please. So when do we meet? We get this question a lot. When do I meet with tobacco industry representatives? Next. Only when necessary for regulatory purpose. So I know that many times elected officials or people's in the executive branch get calls and like, oh, I just have new data. Oh, can we have a meeting? I want to discuss this legislation that is being discussed. You really should not have meetings that are private with the tobacco industry. Only meetings that are necessary for regulatory purpose, where you are informing the industry about new regulations. When these meetings happen, that should be transparency. For example, in public hearings or other places where there is an opportunity for others to participate. And there should be an agenda that is made public, and the minutes that are made public with maybe minor redactions if trade secrets are being discussed. But the more you shed light on these meetings, the better it is, and the better to avoid industry interference. And again, very limited times when they are necessary. Next, please. The other issue that we try to support is implementation of a code of conduct, a code of ethics, which most countries already have. And think of these as a protection for civil service and elected officials from the perception. Think of these as a shield. It's not a punishment. It's not trying to constrain what you can do in your job or in your role, but it's really to provide you some sort of backup when you are trying to get some guidance and implement guidance to engage with the tobacco industry when and if is necessary. Next, please. So let's keep in mind that most effective tobacco control is antithetical to the economic interest of the tobacco industry. And we heard some of you speaking about that already. And when tobacco control succeeds, the tobacco industry fails. I mean, if we are trying to end tobacco, we can't continue with an industry that continue to generate profits from people's getting addicted, diseased, and dying. It is very predictable what the industry will do. So please, if you are trying to pass legislation, if you're trying to pass a new policy, do reach out to the Secretariat, to your WHO colleagues, because by and large, we really know what the industry will do to try to oppose. And the more prepared you are, the better you are to prevent that interference. And just remember that there is a irreconcilable conflict of interest between the industry and public health. Thank you very much. I appreciate being here.
Thank you very much, Dr. Bialus, for your time and sharing these remarks and comments as well. And obviously the importance of reaffirming the importance of Article 5.3 of the WHO FCTC in this regard, of course, as well. Let's come next then, please, to the resident representative of the United Nations Development Programme in Georgia, Dr. Douglas Webb. Dr. Webb, it's great to have you with us. Dr. Webb will be speaking on the WHO FCTC as a driver for sustainable development. Dr. Webb, the floor is yours.
Thanks, Rayan. Hi, everybody. Good to see everybody. And thank you to the FCT Secretariat for inviting UNDP to this conversation and for the close collaboration we've had over the past 5 or 6 or 7 years now in this area. Just to start, I mean, we're at the high-level political forum on the side margins, talking about SDGs. The SDGs are a little bit unhealthy right now, I would say. The progress report for this year, 2/3 of the targets are off track. 1 in 5 have regressed over the past 10 years. This is not a problem of resources, of course. This is a problem of probably bad decisions and misaligned priorities, which is why the WHO FCTC is such an important instrument, because we recognize it from the developmental perspective as being one of the most cost-effective tools we have in terms of saving lives, easing pressure on health systems, and generating cost benefits across goals. A study UNDP did with the Convention Secretariat we did this a few years ago. We found that tobacco undermines 67 SDG targets, nearly 40% of the entire agenda. Undermining interactions from caregiving burdens on women, and things like environmental concerns. Well, let's not forget that cigarette butts are the most common littered plastic items. The impacts on oceans and ecosystems, and the plastic treaty is moving now. So we often forget the wide impacts across sectors. Since 2016, we've been working with the Secretariat on the FCTC 2030 project, and that's been mentioned a few times. We've supported about 30 countries now in advancing treaty implementation through the investment cases, through sustainable financing, through tobacco control governance. We've learned a lot in doing this. You can imagine the experience we've got. A few things to mention. Firstly, use country evidence. Try not to import evidence. Use national evidence to engage stakeholders. It's reframe action as a high return investment. It's not a cost, and dispel economic myths. As Stella just said, the industry will be ready to counteract any arguments that you have. Second, build a common language across government departments. They've all got their own lexicon and their own sort of understanding of the way the world operates. And tobacco is often seen to be a health problem, but actually it's one of finance, one of labor, planning, environment, and each entity will have its own entry point and particular specific framing of the tobacco sort of construct, if you like. And we've learned the language and the mechanisms to get different constituencies involved. And the investment cases, of course, what they do is show the distribution of costs across government. Most of the costs are not to the health sector. They are to industry, and they are to the labor force through presenteeism, absenteeism. Get different constituencies involved: media, civil society, youth, and particularly legislation. In Georgia, the investment case was very impactful. This was done now 7 years ago. It described over 11,000 lives lost a year, 2.5% GDP drained annually. With implementation of the FCTC, we could see 50,000 lives saved and $1.5 billion in costs averted. This allowed the Ministry of Labour, Health and Social Affairs to work with MPs to pass a fairly comprehensive tobacco control legislation, which has faced a lot of hurdles, of course. This has gone forwards and backwards in the last 12 months, in fact. We saw tobacco taxes actually go down in the last 12 months due to various forces, which Stella could talk about. And in the UN country team, ourselves, UNDP and WHO, pushed out a fairly unpleasant statement saying how disappointed we were. This delayed processes, this delayed actually things. Taxes actually went back up again not long ago. And actually now we're pleased to say that plain packaging is now being enforced as of April this year. Interestingly, also, we've now, with of the national voluntary national reviews, we now have tobacco use as an indicator at municipal level in some of the voluntary local reviews. So this is an interesting process where we're getting tobacco use and tobacco control into development planning at local level, which is an interesting move from the national level. So going forward, in terms of tobacco control and development, what do we want to do in terms of maybe the next 20 years or the next at least 20 months? We've got to get tobacco taxation back into the conversation much more strongly than we have been. We've let it slip to a certain extent. We know that the recent reports looking at raising prices on tobacco, alcohol, and sugary drinks, raise prices by 50% could generate $3.7 trillion in 5 years. This is a no-brainer. This is a political choice. And we could do incredible things for domestic financing. And let's capitalize on the severe commitments which look at health taxes. And this is an opportunity for the entire development system to take forward fiscal space on health. The NCD political declaration is not yet obviously written or agreed, but 80% of countries implementing excise taxes on tobacco, alcohol, sugary drinks by 2030 would be a massive step forward. UNDP is happy to work with WHO member states on the 3x35 initiative, which aims to raise real prices of tobacco, alcohol, and sugar drinks by 50% by 2035 through health taxes. We need to take the investment cases that we've done through the FCT 2030 project, we've done 36, into legislation particularly, where we could save 2.3 million lives and avert $90 billion worth of costs over the next 15 years. This will take a concerted effort. And my colleagues in New York, the health team, Roy Small, Natalie Lanu, and others, have got the South-South NCD Learning Lab in the UN Multi-Partner Trust Fund on NCDs and mental health to take the lessons learned forward. And then finally, just to reiterate what's been said, Article 5, I think that governance is one of the most crucial areas of the convention that we need to really join hands and work in more and more. And I think with WHO, the Secretariat colleagues, this is a conversation we've had many, many times, but to get parliamentarians, the legislative framework, and the UN Development System, UNDP, this is an area that we can really move forward on as a massive trigger in taking the convention forward. So we are happy to continue the conversation. Good to see you all. And here's to the next 20 years. Thank you so much.
Thank you very much, Dr. Webb, for those remarks. And just taking some notes down here, what you mentioned about tobacco taxation and the importance of that, and obviously your crucial work on the FCTC 2030 project as well. We look forward to working with you more on that as we move forward. Now let's come to some closing remarks now from Dr. Reina Roa, who is the president of the Conference of the Parties to the WHO FCTC. Of course, as many of you know, the COP happening this year will be happening from the 17th to the 22nd of November. We look forward to seeing many of you there. And without further ado, Dr. Roa, the floor is yours, madam.
Muy buenos días. Al cierre de este foro, agradezco a nuestros distinguidos panelistas sus extraordinarios aportes. Nos han compartido sus experiencias en torno a la ratificación del convenio marco, los procesos parlamentarios y los avances logrados contra la pandemia del tabaquismo. También sobre el impacto en la salud pública, en los ingresos públicos, financiación y tributación de productos de tabaco. Los desafíos actuales, incluyendo la interferencia de la industria tabacalera y la relevancia del convenio marco como herramienta estratégica para promover los objetivos de desarrollo sostenibles. Como se ha indicado, el control de tabaco es esencial para alcanzar los ODS. De allí nuestro compromiso con el ODS 3 sobre salud y bienestar, incluida la meta 3 sobre implementación plena del convenio marco. También destaco las sinergias de este convenio con los ODS 10 sobre reducción de desigualdades, el ODS 14 que aborda la conservación y utilización sostenible de los océanos, los mares y recursos marinos para el desarrollo sostenible, recordando que los plásticos de las colillas son uno de los mayores contaminantes, y el ODS 15 sobre la protección de la contaminación ambiental y degradación de los suelos, aspectos vinculados directamente con el cultivo del tabaco. El convenio marco de la OMS es un instrumento de desarrollo vinculante y centrado en los derechos humanos. Protege la salud y la vida de las personas e involucra a todos los sectores gubernamentales y de la sociedad. Su aplicación efectiva tiene un impacto en las condiciones de salud, en la calidad y el bienestar de vida. La evidencia indica que el tabaco actúa contra el desarrollo sostenible, merma la producción. Perdón, ¿me escucharon?
Loud and clear, please.
Y propicia la explotación para el cultivo de tabaco con los riesgos específicos que ello genera. Durante estos 20 años de implementación del convenio marco, ha sido clave el compromiso político para alcanzar resultados concretos, haciendo posible disminuir la prevalencia de uso de productos de tabaco, avanzar en la protección de los daños, discapacidad y muerte asociada a la explotación de los productos de tabaco y actuar contra la adicción y contra la toxicidad de sus emisiones. Este 20º aniversario del convenio marco es un hito y un llamado a acelerar la acción, cerrando brechas de implementación entre sus artículos como entre las partes. Necesitamos hacer de cada circunstancia una oportunidad para continuar dialogando hacia el progreso en el control efectivo de la demanda y oferta de los productos de tabaco, conforme con las mejores prácticas expresadas en el convenio marco, su protocolo y directrices, favoreciendo así el logro de los 17 ODS. Me atrevo a asegurar que el camino es el diálogo continuo, abordando al menos 4 aspectos. Primero, visualizar el convenio marco como un enfoque de derecho humano, como política integral y sostenible, donde la cooperación internacional y el multilateralismo son esenciales para definir escenarios futuros de actuación en salud pública y disminuir las brechas existentes. Segundo, cómo fortalecer las capacidades y otras estrategias para dar sostenibilidad a la gobernanza, a la vigilancia de la epidemia del tabaquismo y al cumplimiento del marco legal del control de tabaco, avanzando en la implementación del protocolo. Tercero, cómo gestionar la prioridad de enfrentar los retos de las nuevas tecnologías para el uso del tabaco y nicotina y la integración de la implementación del convenio en los planes de desarrollo y en marcos de financiación. Y cuarto, qué hacer y cómo hacer para alcanzar el final del juego, logrando prevalencias de consumo que no superen el 5%. Para terminar, quiero recordarles la importancia de participar en la COP11 y la MON4, que como ya ha comentado Ryan, se llevarán a cabo en el mes de noviembre de este año. Agradezco nuevamente a los panelistas su presencia, no sin antes indicar que reconozco que a los 20 años de la entrada en vigor del convenio persisten desafíos y retos para su implementación, donde la interferencia de la industria tabacalera es uno de ellos, quizás el más relevante. Muchas gracias nuevamente.
Thank you, Dr. Robert. Great to see you and look forward to, of course, seeing you very soon, of course, at the COP this year as well. Thank you to all of the above speakers for their time and for their remarks earlier today on so many different topics, of course, not just celebrating the 20-year anniversary of the entry into force of the WHO FCTC, but of course also its importance to sustainable development as a whole. We will close here, but we do hope that you keep in touch with the WHO FCTC Secretariat. You can keep in touch with us, of course, via social media channels, where you can find us on all the main social media channels, on our website, of course, as well, and by email as well. It's FCTC Secretariat at WHO.int. That's FCTC Secretariat at WHO.int. We look forward to being in touch with you and, of course, collaborating with you all in the years and months ahead. Once again, thank you to all of the speakers and to all of you for joining us today. Goodbye.